are those of the hosts, guests, and callers. They are not intended in any way to diagnose, treat, cure, or prevent disease.
Welcome to Weight Loss Conversations, brought to you by 3 Health Medical Weight Loss Solutions. Your hosts, Bradley Butterfield, Marlene Sexton, and Brandy Wiltermuth, have over 30 years' experience treating health issues associated with excess body weight. Get ready for an in-depth, honest discussion about weight loss and your health. Be sure to visit our website at 3.health. That's THREE.health.
Good morning. Welcome to Weight Loss Conversations with 3 Health. This is Brad Butterfield. I'm the Executive Director at 3 Health and also a practicing psychotherapist. With me this morning are my partners, Brandy Wiltermuth, ARNP, and our Medical Director at 3 Health. Hi, Brandy.
Hello.
And Marlene Sexton, also a practicing psychotherapist at 3 Health and our Director of Therapy.
Good morning.
Today, we're going to take on a subject that actually I was a little bit reticent to tackle, but because of all the pundits on the different newscasts and in our political season that seems to be ever present and coming up, I thought that it would be interesting for our listeners and in particular for our many patients. We're going to talk about health insurance.
Ooh, hot topic.
Yeah, it affects everybody out there.
Mm-hmm.
It's we're hearing so much. It depends on whether you're listening to MSNBC or CNN or Fox News. You're going to get the subject of health insurance from the left, from the right. You're going to get all kinds of different opinions about health insurance, and it's a question that our patients or prospective patients are often asking us is, can I use my insurance? And when we started this practice, we all came out of other practices, but when we started this practice in particular, we had to make some difficult decisions about health insurance and about cash pay and what we were going to do to keep our costs down for our patients and yet be able to have enough income to run our practice. So,
Yeah, it's a real hard thing to balance out, but I think 3 Health has come up with a pretty good solution to it, obviously.
You know what, I went back to that conversation and we talked about how would you ever be able to estimate your income? Because every single insurance company is going to reimburse us at a different rate depending on the person's deductible and if they were out of network. And I mean, there's just so many variables, and it makes it really confusing. I think that's the vein that everyone feels, that it is just really hard to get a handle on it and to understand what's going on with it.
and there's so much frustration because year after year, it seems that we're all paying higher monthly premiums, higher copays, and we're seeing higher deductibles. It feels like even those of us that are in medicine, we often can't afford to go to the doctor.
Right. And then the reimbursements are also going down.
Right. So the system feels kind of broken, doesn't it?
That's a nice way of saying it.
Yeah. And it's interesting. I was going to share a personal story. Last year, I was invited to have breakfast with our governor, Jay Inslee, and I thought I would be in a room with 400 or 500 people when I was invited to breakfast, and I found myself in a room with 30 people.
Wow.
And it was about our healthcare system and about it feeling broken. And a physician got up. He was a primary care physician. And he looked at Governor Inslee and he said, "Governor, my average reimbursement per visit for a Medicare patient is $35. And he said, how do you expect me to run my practice on a reimbursement of $35 per patient? And although the governor was very empathic and was a good listener about that, if you think about it, $35 for one patient visit is pretty tough. You really, if you're running a full staff, and you're paying for all of your medical liability insurance, and you're paying your rent, and you're paying your utilities, and you're paying wages, and you're paying taxes. You can just imagine to run a business on $35 per
Let's
visit.
not forget about the EMR, which has to record everything that you do for Medicare perfectly, or you won't get paid.
That's right. That's one side of it. And so we're hearing on one side of the political debate is that Medicare for all. And yet on the other side, I personally am paying about $750 a month for a healthcare premium with a $5,000 deductible. So when I do the math on that one, I can't afford really to go to the doctor. Or if I do go to the doctor, put it this way, I'm paying out of pocket, even though I'm paying $750 a month for that health insurance. That's really for emergency care or for if something catastrophic happens.
Yeah.
So we're getting hit on both ends, aren't we?
And we sure are.
Yeah, and I think what I'm describing is pretty common.
Yeah, I've heard from a lot of clients that is the case. It's certainly the case with my husband and I, paying huge premiums, have, I think, a $5,000-$6,000 deductible. We're both in really good health, and it was explained to me that we're buying peace of mind. That's pricey peace of mind when I hardly ever, I'm fortunate enough not to have to think of my health all the time, but it is a broken system, and I feel for clients. I know we've had clients and talked to patients that are rationing their insulin because it's so expensive.
Right. There was. It's interesting that you would mention that, Marlene, because last week we said that I stated our program was about pharmacotherapy, Brandy, and in the New York Times this weekend there was a great article about the pharmaceutical industry, and on Tuesday there was a Senate panel that was interviewing 8 executives from the top 8 pharmaceutical companies. There were going to be hearings held with the Senate subcommittee, and I was looking at just some of the facts that they were talking about regarding pharmaceuticals, Marlene, since you mentioned it. And they mentioned that insulin has gone up from a monthly use for a diabetic from $200 to $1,500 for the same amount of insulin. You think about that.
That's an increase.
Yeah, and there was one for a malignant osteopetrosis drug. It's gone from, it didn't go from anywhere, but the same drug that's $350 in Britain is $26,000 in the United States for 1 month.
Yeah.
Can you imagine that?
I don't understand how people can take care of themselves.
Well, I think the ongoing debate, or what we should be talking about, is how do we work more on preventative medicine and put our energy into that. And there are a couple healthcare organizations out there that are looking at reimbursing their providers based on patients improving and or avoiding some of these chronic illnesses that are related to lifestyle. Of course, we still need medicine because people are going to get sick. There's going to be problems that arise, and we need to have the medicine to treat that and the specialist to treat it. But I think that the next revolution in healthcare is going to be a focus on helping people prevent these illnesses in the first place, especially the chronic ones that really are what cost us the most. I mean, Medicare dollars spent on diabetes, 1 in 3 is spent on diabetes alone. And that's a lot of money, and that's a lot of people that have, in my mind, a preventable disease. We're not talking about type 1 diabetes, it's type 2. And that is kind of our focus here at 3 Health. I want our patients to know that it might be, an expense that they put forward right now, but it's really hard to be a diabetic. it's very debilitating, and it's definitely something that we can, if not reverse and put into remission, we can help control it.
Yeah. And I think that because so many people have diabetes that it tends to, I've had clients say, well, it's just diabetes.
Yeah.
It really is a very serious disease, and if it can be prevented or reversed, that's going to save.
And it can, and we do that every day here. We just need more people like us and what we do and make that more mainstream instead of us being kind of the outlier.
So we do need to take a break. We're talking about health insurance and the practice of medicine in the United States today. We're going to take a break. This is Weight Loss Conversations with 3 Health. We'll be right back.
Introducing 3 Health Medical Weight Loss Solutions, a unique weight loss clinic backed by real medical research with a treatment focusing on the entire person, mind, body, and spirit. From medical services for obesity and high blood pressure to behavioral services for emotional eating and depression, 3 Health Medical Weight Loss Solutions can help you change your relationship with food, your relationship with yourself, and with life. Find out more, 425-606-0022. Or online at 3.health. That's 3.health.
Conversation you won't find on the rest of the dial. Alternative Talk 1150.
Welcome back to Weight Loss Conversations with 3 Health. We're talking today about the health insurance industry and medicine and healthcare in the United States. And just before the break, Brandy, you had talked about diabetes and the fact that 1 in 3 healthcare dollars in the United States are being spent on diabetes coverage. Mm-hmm. And you said that was type 2 adult onset diabetes. And how significant that is.
It is. It is overwhelming. And I think if we think about how most of the people that have type 2 diabetes probably had warning signs much earlier than their diagnosis. And for whatever reason, I don't know if it's the patient's mindset or the primary care provider's mindset that everyone has diabetes, so what's the big deal? We just treat it this way, and there's a standard of care, and we follow that. But it's a preventable thing if we can catch it early enough, and it is tightly correlated with overweight and obesity or rapid weight gain.
What are some of the symptoms, you said earlier, symptoms that maybe get overlooked?
Some of the early symptoms are things like having pretty significant hypoglycemia. So that's when people get really shaky and nauseous and dizzy when their blood sugar decreases. And that alone is not diagnostic, but it does clue you in, or us in, to the fact that there's a blood sugar regulation problem. And if we further investigate, most of those people I find have elevated fasting insulin, not in correlation to what their blood glucose is. So that means that their insulin's working too good and it's working overtime in response to the carbohydrates that people are eating. And it's doing that to help protect us, because if the body has an abundance of sugar left in the blood vessels in circulation, that's how organs get damaged. So the body is doing its job, which is compensating for the sugar by producing more insulin, but it can overcorrect, and then people feel hypoglycemic. Some of the later signs are things like having excessive thirst or hunger, and just it can't be satisfied by eating or drinking. And that means that your body is now moved on to utilizing its own tissues as energy, because the body doesn't respond to the insulin, or people aren't making the insulin in response to what they're eating. So, there's a few things in between there that sometimes people can pick up on, but regular screening should help detect elevations in blood sugar, but it's not commonly tested to do a more in-depth look at blood sugar and insulin. Most primary care people don't do that.
Well, if you have 6 minutes with the client.
Exactly.
Patient.
Or 6 minutes for a primary care physician, Marlene, is maybe a lot. Actually, most primary care physicians today, if you look at the numbers, have 3 or 4 minutes, frankly.
Yeah.
And what is even more frustrating about that in terms of doing that for patient care is not just the fact that you're feeling rushed and you have, very little time with people. I think it's a huge loss of opportunity to teach. Imagine the 20 years, 30 years experience that a primary care provider has.
Yeah.
And they literally don't have time to use that knowledge to teach us anything. And what a lot of people don't know, and I think is just mind-boggling, is that as a primary care provider, or I worked in internal medicine, you can only see one problem at a time.
Yeah.
Exactly. That was my point.
But you have to bill for 3 comorbidities every visit to get paid.
So, Brandy, I want to take about 2 steps back here.
Okay.
You're an expert in dealing with diabetes, type 2 diabetes, because we have a number of patients that struggle with this. We have a number of patients that we see that are pre-diabetic. We talked about that in a previous program. We know that being overweight and dealing with obesity can be and is a precursor for adult onset diabetes. And yet, isn't it true that most insurance companies don't have obesity or bariatric coverage as a primary coverage in health insurance?
That's exactly right, and another travesty, right?
Right. So we're dealing with a horrible problem that's on the increase in this country with health, which is diabetes.
That is treatable.
That is treatable, but we don't deal with primary cause, which is obesity.
And not everybody. Obviously there are people who are normal weight that become type 2 diabetics, but the majority of people do have excess weight and a strong family history and other comorbidities that we can bill for, but it's absurd that we can't bill for what the disease process that we treat.
Well, This may sound strange, but on the backside, I guess, because we are a medical weight loss practice, somebody calls us and says, "Can I use my insurance?" At least the answer typically is yes. But you have to get pretty creative in the billing process to find comorbidities so that we can bill. And so Alexis has to really work hard to make sure that our patients
work
get
together
reimbursed.
to pull out a bunch of different diagnoses.
Which are legitimate. Those are allowed by the insurance company, but it takes a lot of time and effort to make this happen.
Yeah, and I don't really know the history of why that is that way. I can only imagine that if we suggested to the insurance companies that they had to cover obesity or overweight, 70% of people would automatically get their claims covered for that.
Well, okay, so we talked about being diabetic. Let's review again the number of comorbidities or number of illnesses that might come out of struggling with being overweight or obese. It's not just diabetes.
Oh gosh, how much time you got?
Well, yeah, we've
been looking at joint disease and
There's 2 different classifications really. There's metabolic disease, which is things like cholesterol, hypertension, diabetes, those kinds of things, PCOS, anything kind of hormonally related to weight gain. And then there's a whole other group of illnesses that are called the fat mass disease or mass disease, which is the mass of the weight on your body.
So lower extremity orthopedic problems, ankles, knees, hips.
Breathing.
Okay.
Any
All right.
GERD, those kinds of things that you have to move the weight around in your body and or move your body to breathe or function, and you have to move a lot of weight to do it.
It's significant.
Yes.
Okay. So.
And we also see a lot of depression.
Yes, we
from
do.
weight.
We do. And it's sort of, I don't know if it's the whole, the chicken or the egg thing. Mm-hmm. Are people depressed because of their weight, or are they overweight because they're depressed? And I think it's both and. I
do too.
It goes back and forth, and it's individual, but that is a very common condition that we see in our population.
Right. So being overweight, being obese is a precursor to so many different illnesses.
Right. And the medical community as a whole is really good at treating those other conditions, mainly with medication, because, again, as a primary care doctor, if you have 6 minutes and you could give a dissertation for an hour on treatment of cholesterol, but you've got 6 minutes to do something about this with the patient, you're going to write a prescription.
Okay.
Because that's the most effective thing you can do in the time allowed. And maybe order a blood test and say, come back in 3 months and we need to monitor this.
So the consumer, in this case, the people, all of us, I use the word
Seeking
consumer.
healthcare.
That are seeking, we are all seeking healthcare. We're all paying for our health insurance. And eventually we are all patients. We're all struggling with this.
Yeah.
Yeah. It's a complex problem. And even though we may watch both sides of this problem on the news, there don't seem to be any simple answers.
Well, like most complex problems, there isn't a simple solution, and I can empathize with patients, and I definitely empathize with people who make their living based on billing insurance for what they do in terms of medical care that they provide. And, we're kind of in the middle. We're sort of a hybrid in terms of how we look at this issue, which gives people choice and I think a little bit more freedom than some of the plans where they say you can't go to any doctor outside of this, organization or those kinds of things. I think the model that we have come up with, and that honestly isn't new, it's been around quite a while, especially for weight loss, is pretty effective. Most of our patients are pretty pleased with the fact that we take care of the claim submission for them because they're most likely not going to do it. And then we all sit and wait and see what happens and see what kind of reimbursement comes back to them. But at the same time, I think most people are pretty confident that they're doing a really good thing for their health. And that in itself is
a really important point, is that, spending money up front to prevent not only just big bills later, but prevent the health problems that come with obesity. So can you describe the super bill that we do?
So the super bills are kind of nice because they don't require a whole lot of detail. We need some information on there, obviously, but when providers contracted with healthcare insurances, the amount of information that they have to provide to substantiate the claim is, a little overwhelming, to be honest. And there are a lot of people in the insurance industry working specifically to figure out what you did wrong with your claim. So it gets sent back or have to be revised. So what we do is we send a super bill, which includes all pertinent information like the provider, the patient, the date of the visit, the cost of the visit, and the codes that were used to designate the diagnosis that we're treating. And we send that in to the insurance company, They look it over. Obviously, they have to take into account the person's deductible and their, certain benefits, and if they have out-of-network. And then the patients get reimbursed directly, so we don't see that money. It goes right back to the patient, which is also kind of nice for them.
And then also, too, it enables us to keep our costs down.
Yeah, if we were billing insurance traditionally, we'd need 10 people working.
Yeah, literally.
Just doing that. And we got one.
Well, and I'll speak to something else that's also very important here, Marlene, that you talk about keeping our costs down. When we have to wait on average 4 to 6 months for reimbursement, our costs also go up considerably.
Yeah.
Because of what we have to do to pay our staff, which is very important, and pay all of our other costs. So all of these things add up, and guess who it gets passed on to? It gets passed on to the patient. And so we're trying to keep our costs down for our patients. It's important. We do need to take a break. This is Weight Loss Conversations with 3 Health. We're talking about health insurance and medicine today, and we'll be right back.
With decades of experience helping patients change their lives, 3 Health Weight Loss Solutions can help you too. At 3 Health, we provide proven and science-based solutions for realistic, achievable, and sustainable results. We're unique, just like you, and the relationships you have with food and yourself. Find out how we treat obesity, depression, high cholesterol, and more. Just give us a call and change your life today. 425-606-0022. Or visit us online at 3.health. That's THREE.health.
An alternative to everything else on your radio dial. Alternative Talk 1150.
Welcome back. This is Weight Loss Conversations with 3 Health. We're talking today about the health insurance industry and the medical industry in the United States today, and how all of us as consumers and eventually patients are seeming to be more frustrated year after year with what we're seeing in higher monthly premiums and higher co-pays and higher deductibles.
And higher drug costs.
Yeah, and it seems like it can't get worse every year, and it
does somehow.
Yeah. So I was going to share a story that I've shared, Marlene and Brandy, with you in the past. I've been a business owner for a number of years in different businesses, and my practices and businesses were typically between 100 and 200 employees. And I think it was probably every August, it seems like our health insurance representative would come to the company and talk to the owners or partners and talk to us about what was going to happen with our health insurance package for our employees starting, in the following year. And that was probably the worst meeting that as a business owner I would have every year. Meeting with employees about their salaries and or their annual reviews seemed to be easier than that annual meeting that we would have with all of the employees about what was happening with their benefits.
Did you learn how to duck?
Well, yeah. It was always, for the company, was higher premiums, more expense, and higher co-pays for our employees, and higher deductibles. And it just, when it seemed like it couldn't get worse, it did every year. And so we would have an annual company meeting, and we would explain this. And that was seriously, that was the worst meeting of the year that we had with our employees. People were more upset at that meeting than any other time of the year. And it was horrible. As a business owner, I hated that annual meeting because of what was happening with health insurance.
Yeah. It wasn't very much fun as an employee either.
Yeah.
And Brandy and I did a presentation for a service club few months ago on the cost of obesity to a business, and yet people can't afford to treat obesity.
Mm-hmm.
It's a catch-22.
It is.
So with 3 Health, how we, with the super bill and people, coming in and being able to spend some time with us and learn about their comorbidities or to learn how to lose weight and sustain that weight loss, it really is saving.
Right.
But if people say, I'm not going to use my insurance or I can't afford it or whatever, then they're going to have to, I think it's a man named Edward Stanley that said if you don't take time for health care, for self-care, that you're going to have to take time for illness.
Mm-hmm.
And it just seems like the insurance companies or the government or whatever needs to get on that.
Right.
Well,
right.
I guess, Marlene, at the very least, if you have a high deductible and we do the super bill, Brandy, that does get credited against your deductible, your annual deductible.
It can.
Okay.
It usually does unless they don't have any out-of-network benefit.
Okay.
So, again, every person is different. And
Talk to me a little bit about the HSA. A lot of our patients will use a health savings account for their care.
Yeah, health savings accounts are great. So basically what it is you designate money to be taken out of your pay pre-tax to be put into an account that you can use on healthcare expenses. And those are, variable in terms of how much you can put away. I think the cap on that now is $3,500 a year. Which if you have a $5,000 deductible, you'll still end up paying quite a bit of your deductible before your insurance kicks in. But it's something, and it's a nice way to maybe have a little bit more confidence that if you do get sick, you have a little bit of money set aside for that.
Okay. Another large and significant issue is the idea of today's technology, and that is telemedicine. The insurance industry has really lagged behind in telemedicine, and yet we're using telemedicine in our practice, and it's really been significant for us.
Yeah, I mean, anyone who lives in the Seattle area knows that getting in your car, first of all, taking time off work, getting in your car and driving to your doctor's appointment is going to be probably a half a day. It's going to take you.
And also getting a babysitter.
Right.
If you have children at home, young children at home.
Or if you've got to be back at a certain time to pick kids up or to get back to work or something, it's a real easy way to say I'm not going to take care of myself.
It's just not worth it.
Yeah.
Fighting the traffic and getting behind and late on everything. So from the very get-go, we talked about having to have telemedicine as an option for our patients. And I think that's a reasonable way to help people stay connected too.
Yeah.
Because we rely on seeing people fairly often. And it might be different if you go to your primary care every 6 months. You can afford to take a half a day off work. But we see people every 2 to 4 weeks. And so asking them to get in their car and drive through Seattle traffic twice a month is pretty hard. So telemedicine has been a great feature that we can offer. And again, if we did contract with insurance, it wouldn't be reimbursed. Or if it was, it would be minimal. At best. So I think that's a great service that we provide, and it's convenient for us as well. I mean, during the snow, we were able to continue seeing people,
Right. Good point.
Which would have been lost, time and delaying people's program progress and things like that. So it's a great invention, and I don't know if there are plans for the insurance companies to adopt more of that and to make that part of a health benefit, but we're not waiting for them.
Yeah.
And our telemedicine is HIPAA secure.
Yes, HIPAA compliant. So we make sure that the video is going to be able to be done in at least a secure setting on our part. We can't guarantee that the person on the other end is that worried about their health information, but it's the way the information is transmitted is HIPAA compliant. So
Yeah, it's kind of like Skype, only it's HIPAA compliant.
Right. A little more technical.
And I've had clients that will telecommute or whatever on their lunch hour, so that they don't have to miss any work. They don't have to do that stressful thing of telling your employer, I've got to take some time off.
Especially imagine doing that when you aren't sick.
Yeah.
You know, imagine saying, I got to go to this appointment every other Wednesday at 3 o'clock, and they're like, well, are you okay? Yeah, I'm good.
I'm fine. I'm just leaving every other Wednesday.
I'm doing preventative stuff. It'd be a hard sell, I think.
Yeah.
Well, and we also have some patients that are in Eastern Washington.
Yes.
That they will come over every couple of months to see us when they need to.
Or have mobility issues.
Right. And we work with them across the mountains through telemedicine, which has been highly effective.
Yeah. A lot of ways working around the difficult system.
Well, I think that just speaks to the larger issue of people just have to get more creative and look at how insurance can be more available. You know, how is it being dispersed?
What can the average person do? I mean, calling your representative?
I would start there.
I kind of had a little fit the other day when some politician called to ask for money, and I said, I'm not giving any more money until you come up with solutions. I know what's going on. I want to hear a solution. And I think our leaders need to start looking at that quit really whining about what the other side is doing and start coming up with some ideas of how they're going to solve the problem.
Right.
And I don't think it's an either or.
No.
We're right, you're wrong.
Nope.
You're wrong, we're right answer. And when that, I started the show by saying we're getting both right and left. We're getting really simple answers, and this isn't a simple answer. It's complicated.
And read 7 Habits of Highly Successful People and start with the end in mind, which would be quality health care at a reasonable price.
Right.
And then start solving for it.
Right.
Because people everyone deserves health care.
Health care is not a privilege.
No, it's a right.
It's a right.
And it's really, it's kind of crazy to think about how healthcare is handled in different countries. I don't think any country can stand up and say our way is perfect and, we catch everybody and everything is super great, but I think our country has to look at other examples of what's being done successfully and utilize some of those things. Yeah.
Well, and I'm of the age, and I won't talk about anybody else's age around the table here, but I'm of the age that frankly, my health care insurance at one time was pretty sacred to me. I wanted to hold on to that, and it was very useful. And now, as I explained at the beginning of the show, with my high premium and the deductible, I just don't use it. But I am fearful not to have it.
Yeah.
And so when people say, gosh, you have to have your health care insurance or how precious that is to me, it doesn't feel so special anymore or so precious.
No, it almost feels more like a burden, but... if something were to happen, you'd be glad you had it.
Sure, and that we all know that that's true.
Yeah.
So we are going to take a break. This is Weight Loss Conversations with 3 Health. We're talking about health insurance and the practice of medicine in the United States today. We'll be right back.
Introducing 3 Health Medical Weight Loss Solutions, a unique weight loss clinic backed by real medical research with a treatment focusing on the entire person, mind, body, and spirit. From medical services for obesity and high blood pressure to behavioral services for emotional eating and depression, 3 Health Medical Weight Loss Solutions can help you change your relationship with food, your relationship with yourself, and with life. Find out more, 425-606-0022, or online at 3.health. That's 3.health.
Seattle, Tacoma, Antwerp. That's right. We're streamed worldwide on our app and on the web at 1150kknw.com.
Welcome back to Weight Loss Conversations with 3 Health. We've been talking about health insurance and the practice of medicine in the United States today. We've been talking about health insurance and how all of us, as both consumers and eventually patients, are probably pretty frustrated with health insurance and the cost of taking care of ourselves in medicine. We all are consumers and paying for our health insurance either through our companies or out of our pockets. I guess it's all one and the same, isn't it? And just some of our frustrations. So, Brandy, at the break, we were talking about wellness programs or corporate wellness programs. Mm-hmm. Tell me a little bit about what you think about those.
I think that they have great intentions. I think that when an employer recognizes that their employees are valuable and their health will influence overall cost for the employer, that these corporate wellness programs have really convinced, and it's true, that we need to look at that and help people as much as we can. The downfall of most of them, I believe, is that not only are they a one-size-fits-all, where they take everybody in the company and run them through some simple testing, which honestly would catch the worst of the worst problems, but there's no individualization in terms of what to do. And I think that it's very watered down. It's, you're not seeing a physician or a nurse practitioner. Usually it's, people who are just trained to give you the blanket advice that goes along with some of the test results. And we know that it doesn't work that way because people are so individual in terms of their family history, their own medical history, their lifestyle, their work schedules. All those things are going to influence what steps that person takes to improve their health or gain wellness or protect their wellness. And I think that even though their intentions are noble, I don't feel like any wellness program I've ever been a part of, or the ones that I've seen being delivered to other employees, has been very valuable overall. And I'm sure they cost the employer quite a bit of money to administer.
There are also some downsides to whatever behavioral things that they'll do. I've had clients say that they'll skip work on the day that they're doing, like they'll put people in a group and whoever loses the most weight.
Yeah.
And a client will skip work, an employee will skip work to avoid that day, so you take into the cost of productivity. And, it's more important that the person is feeling shamed or embarrassed by their progress. So I would like to say that 3 Health can come in if you're an employer and looking for a wellness program that works. Contact us at 3 Health, and we'd be happy to come in and either direct one or give you some information about it. Mm-hmm. So wellness programs, I think, are an excellent idea. It's just that they're not really done. The intent is good.
Yeah, and I think, I don't know this for sure, but I feel like the insurance companies came up with these wellness programs, mm-hmm. and if you do this, then we'll, give you a break on your premiums. Yeah. But I just don't feel like the development of those programs, a whole lot of actual expertise has been put into those.
Right. Yeah, if they're one size fits all, I can tell you right now they won't work.
It's interesting, though. We have a number of patients that are coming out of the same companies because they're having success, and word of mouth through that company has brought groups of patients from the same company to
us. Yeah,
right.
Which had a wellness program. Many of them participated in it. I mean, almost all of them, because I think there was a requirement. And so I speak about the effectiveness of those from seeing these people.
Mm-hmm. And some were successful at losing weight, but then they gained it back when they weren't feeling the competition from it or the obligation.
Well, I think it's also a huge challenge when the corporate culture doesn't change,
right.
And you're just, telling the employees individually to change their behavior.
Mm-hmm. Yeah.
That's pretty...
It was interesting because I talk about snacks at work, and they just have vending machines with junk in them. And
or it's free. It's just sitting there free. I hear that very often, especially in some of the bigger corporations around Seattle.
Mm-hmm. Yeah, the donut tables and stuff.
Yeah.
So.
Well, and it's interesting. It comes to mind. My first year-long internship out of graduate school was at a local hospital, which I loved the work. Unfortunately, our hospitals are known for poor eating habits among employees, and there were some floors in the hospitals that had really healthy eating, and then there were some floors that had really unhealthy eating. It was kind of interesting to compare, even floor by floor, how that was working. And the same's true even in our different clinics. We've tried to practice in our clinic healthy eating. Brandy, I know that you wouldn't have it any other way, but
my previous employment, it was unbelievable what I saw come into that place, and I was like, come on, we're all healthcare providers. We could do a little bit better with that.
Yeah, I was doing a group one night when some of the administrators were upstairs having a meeting, and they ordered 10 pizzas, and the pizza guy walked right through my group with all these pizzas.
This was a support group for weight loss.
A support group for weight loss.
Yeah, that was helpful.
Yeah, it was. It got me thinking quickly on my feet. We just talked about sabotage, but
not to mention the smell. I'm sure when the pizzas walked through,
it was.
Been difficult,
I was appalled.
Yeah.
But and I see 3 Health is living up to what we preach. I mean, we are healthcare providers, and like any health is important, so we won't be dragging pizzas through the lobby or smoking cigarettes in the outside.
Yeah, no, that's just not how we roll.
So we've talked about a number of things today. In regards to health insurance and the practice of medicine. We're hearing a number of things as the political season seems to get wound up, and we have more candidates kind of jumping on what we'll see our bandwagon for our presidential elections. It's I think we know, being in medicine, that there are no simple answers. There are many complications, and this is a complicated subject.
Yes, it is.
And as medical providers, we often feel like we're caught in the middle between insurance companies and our patients. And our goal for our patients, of course, is to provide them the best medical care and for the best cost, or the least amount of money. We're certainly not sitting here getting wealthy. We do want to make a living and be successful so that we can continue on. That's one of our goals. So, what I think, if I had a takeaway here today, because every week we do want to have a takeaway, and you, Marlene and Brandy, you two can jump in here, is that because 3 Health is a medical weight loss practice, and we're all Washington State Department of Health licensed professionals, we can bill insurance companies, and our patients can use their medical insurance where applicable. We've talked about how complicated that can be at times. Alexis made a great point at the break. She said, be sure and remind everybody that they can also they're qualified to use their HSA accounts. That does make us unique from a commercial weight loss practice where those considerations aren't even available.
No, you're going to pay out of pocket for everything in a commercial weight loss.
And we've also found that we are very similarly priced to most commercial programs.
Or better.
Yeah, we're no more money, and once you consider the reimbursement of insurance or using your tax-free or before-tax HSA money, we're less money.
Yeah, and then tack on the fact that we aren't set up to only be successful if people keep coming back.
Yeah.
Our goal is sustainable weight loss. So we want to see you and help you, but then we want you to go and tell everybody where you lost weight, but we don't really need to keep seeing you after you've been successful because we've done a good job.
You're
helping.
saying we never want to see you again?
No, not that.
Okay.
It's just if we do our jobs, instead of having yo-yo dieting, you'll be able to lose weight and keep it off and be healthier.
Right. What else do you all have to add regarding this subject?
Just to have a firm belief, if we can put man on the moon and a robot on Mars, we can solve the healthcare crisis. But it's going to take our politicians to sit down and be the leaders that we voted for and have them start with the end in mind, get along, throw their ideas out there, and solve this issue. It's costing, I don't even know what the stats are in America, how much money we spend on health care.
Well, and we only have so many resources.
Yeah.
It's a finite amount of resources, and
it's kind of embarrassing if you
When you
think
go
about
and
how
you travel.
sophisticated our system is supposed to be and all of the amazing things that we can do as far as treatments and surgery and all that is just unbelievable. That then if you compare us to other countries, that our healthcare outcomes are pretty poor.
They really are.
Brandy, are we
Scary.
statistically a leading nation in obesity?
In terms of our rate of obesity?
Yes.
A lot of the European countries, Canada, are right there with us.
Are they catching up with us?
Yeah.
Okay. That's kind of a sad statement,
I think
isn't it?
Mexico
is.
has the highest rate.
I don't know.
But it changes, and they're all real close to us.
Yeah.
Yeah, it's time for people to start looking at what the solution is and to be unhealthy with something that's preventable.
Well, it just boils down to common sense of if you keep people healthier, they're not going to spend as much money on healthcare. So prevention really is worth it.
Yeah.
And we're finding that taking personal responsibility for our health care is becoming more and more present and true. We used to, I think, feel that somebody else would help us more with that or take care of us. Maybe the health insurance was part of that equation. I don't feel like that's true anymore.
No, and I've dealt with clients with dealing with stress, rationing insulin, or even with their children. I've got grandchildren, and my kids work, and the kids are in school, and it's terrifying to hear a kid cough at night, and you think, okay, do I take him to the doctor tomorrow? If I take him to the doctor, then I need to take the day off work.
Yeah.
If I take the day off work, that's going to affect things. We need to fix the system.
Or even more tragically, being forced to use our emergency room for
Yes.
Pediatric or child health care is really tough.
Yeah.
So I think we all acknowledge that the system is broken and there need to be changes. So it's been a tough conversation. Alexis, you're with us again today, just like you were last week, and you have some announcements about what's coming up at 3 Health.
Yeah, so you guys, we talked about it last week, but actually we're going this weekend to the Northwest Women's Show. So if you guys want to meet us there, we are going to be at booth 619. Tickets are $15. It's on the 9th and the 10th. So you can either come one or both days, and we'll all be there. You guys can get a free in-body biometric testing. And remember, we're not the only people there. So there's fitness, fashion, fun, tons of freebies. Make your way there. It'll be a great, fun event. In addition to getting the free in-body biometric testing, where we get to know what your body mass is, fat mass, lean body mass, if you bring in those results to our clinic, we'll actually give you a 20% discount off a medical evaluation. So bring that in. And if you are interested in some free tickets, we have some for you. You can email us at contactus@3.health. That's THREE.health. And you can always give us a call too if you have some questions. Phone number is 425-606-0022. And you can follow us on Facebook and Instagram under the same name, 3 Health.
Thank you.
Thanks, Alexis. So we will see you again next week, next
Monday.
Monday morning at 8 a.m. on KKNW 1150. Have a good week.
Thanks for listening to Weight Loss Conversations, brought to you by 3 Health Medical Weight Loss Solutions. We love hearing from our audience, so be sure to drop us a note. We so appreciate when you tell family and friends about our program. Also, don't forget that our past programs are found at 1150kknw.com. That's 1150kknw.com. Have a wonderful week and tune in next Monday at 8 a.m. That's 8 a.m. Monday. Be sure to visit our website at 3.health. That's THREE.health.